Emily Marriott and I work on a very busy medical ward caring for elderly patients. I am currently at university as well as working and training to become an assistant practitioner. Today I will be recording a video focusing on the condition chronic obstructive pulmonary disease, as known as COPD. I will discuss what COPD is, the causes and the signs and symptoms. I will then do a case study on a patient in hospital with COPD and discuss the relevant treatments. COPD is an umbrella term for describing a number of lung conditions that are progressive and non-reversible. These conditions make it very difficult for an individual to breathe. According to the British Lung Foundation 2011, an estimated 1.2 million people in the UK are living with COPD. Emphysema is a chronic lung disease that affects the air sacs at the end of the airways in the lungs, causing damage. The lungs then become baggy and full of holes which trap air. These bigger air sacs move less oxygen into the blood, causing an individual to become short of breath. Once damage has occurred, it cannot be replaced. Chronic bronchitis is where the airways become inflamed and narrowed, causing more mucus to be produced. This causes a persistent cough as the body attempts to move the mucus. There are many contributing factors to cause COPD. According to WHO 2016, tobacco-related deaths are projected to increase to 8.3 million deaths per year by 2030. According to the World Health Organization, the primary cause of COPD is smoking. This also includes exposure to secondhand or passive smoking. If an individual has been exposed to harmful substances such as fumes, air pollution, chemicals and dust, this can also be a contributing factor to developing COPD. These are some of the signs and symptoms of COPD. As COPD progresses, more signs and symptoms are evident, such as shortness of breath, even with minimal exertion. Wheezing and chest tightness may occur, and also excessive mucus and phlegm causing a persistent cough. As the disease worsens, it can make it very difficult for an individual to do normal routine activities as they become too breathless. Other signs and symptoms such as unintended weight loss, cyanosis to the peripherals, and swelling to the ankles, legs and feet. Now I will discuss a case study on a patient who was admitted to hospital with an exacerbation of her COPD. For confidentiality reasons, I will refer to the patient as Mrs. X. Mrs. X has recently been diagnosed with her COPD. She is 62 years old and has been smoking for the past 40 years. On hospital admission, Mrs. X presented with a productive cough, shortness of breath, and produced yellow-green sputum. She was seen by the medical team, who sent her for an X-ray to diagnose the severity of her condition. She was given oxygen therapy and a course of antibiotics and also some inhalers. Mrs. X called for help using her nurse call buzzer. She was finding it difficult to speak due to her breathlessness and was feeling very anxious. I told Mrs. X to put her body into the tripod position and gave her a salbutamol inhaler with an aero chamber and asked her to have 2 puffs, keeping her mouth sealed around the chamber. She was also on 2 litres of oxygen by I asked Mrs. X to move into the tripod position. This can be done by leaning forward and resting the elbows on a surface, usually done with a pillow. This position forces the diaphragm down and forward and gives stability to the chest, which reduces the work of breathing. These positions can be done sitting or standing, and it conserves energy. These are some of the treatments and medications for people with COPD. When Mrs. X was deemed medically fit, she was given a discharge letter letting her know about the medications prescribed. She also discussed the medications with a pharmacy technician who was able to answer any questions. Mrs. X left hospital without oxygen therapy, but she may require this in the future. She seemed more confident and was given a letter on how to manage her COPD at home.